Now let's look at this next waveform. The shape is mostly normal until you notice something odd, a sudden dip or notch appearing right in the middle of the plateau phase. This little valley is called a Curare cleft, and it tells us something extremely important. The patient is attempting to breathe against the ventilator. That dip isn't a random artifact. It's the patient's diaphragm trying to contract during the machine-delivered exhalation phase. In other words, the patient isn't fully paralyzed or sedated. They are partially regaining respiratory drive and triggering a small, spontaneous effort in the middle of the exhalation plateau. The ventilator isn't cycling, so the effort shows up as a downward deflection rather than a full breath. A similar phenomenon, the so-called secondary hump, appears when the patient begins to take tiny, assisted breaths as neuromuscular blockade wears off. Both patterns are your early warning that the patient is not in sync with the ventilator, and your sedation or paralytic plan needs attention. From a clinical standpoint, this is not a ventilation problem, and it's not a metabolic issue. This is a neuromuscular issue. Your patient is waking up, fighting the machine, or inadequately sedated. If this continues, they may develop ventilator asynchrony, poor tidal volumes, or sudden loss of airway control. When you see the cleft, treat the cause, not the waveform. Check your sedation level, reassess your paralytic if one was intended, and look for patient discomfort or inadequate analgesia. Once neuromuscular synchrony is restored, the cleft disappears instantly, and the waveform returns to a clean plateau. This is one of the most reliable, non-invasive signs that a patient is waking up or under-sedated. Thanks for watching. If you found this helpful, go ahead and like the video and subscribe to the channel so you don't miss the next one. And if you want the full masterclass, along with tons of other high-yield medical education, visit academy.emergeprep.org. And I'll see you in the next lesson.